There are two tests that we use to look at COVID. The first test is the PCR swab test, which looks for the virus, and that is a swab taken either from the nose or from the back of the mouth, and then in the laboratory it's put into a small cartridge like this, which then goes into a machine, and after an hour or so you get a result which tells you whether the virus is present or not. That PCR test is looking for the early part of the infection when virus is multiplying freely in the nose and in the upper respiratory tract and lower respiratory tract, unopposed at that point by any antibodies. The second test is the antibody test. The antibody blood test can be used from about 10 to 14 days onwards. It becomes more and more positive after 14 days, and that can be done on either a finger prick, in which case people use a small cartridge like this to determine if antibody is present or not, or from the usual type of blood test similar to the blood tests you get when you go to your GP, in which case the sample is put through a much larger machine like the one behind me, and that gives a more accurate test because it has, if you like, all the bells and whistles that go with the laboratory tests. Antibody tests tell you whether you have been exposed to the virus or not. When antibodies are present, your PCR test will be negative because the virus would have been clobbered by the antibodies. It is important to remember that we are still learning very much about COVID, and we are still not quite sure whether the presence of antibody, which implies exposure to infection, implies robust immunity, or and we don't know how long, if immunity exists, we don't know how long it will continue to exist for. The most important test by far and away is the PCR test, because that tells you if you've got infection and if you are infectious to other people. And testing and isolation and tracing is absolutely fundamental to our exit strategy. Finally, of course, I would like to remind everyone that although the number of cases of COVID has dropped significantly, it is still with us. It is still around us. We are pushing very hard to try to reduce transmission even further, but we mustn't think that just because we've got low numbers of COVID that it is still not a threat. It is a threat, so please follow the guidelines and please be safe.